Okay, good morning. The CDC estimates that over 43% of the U.S. population is clinically obese, and under 25% of the population meets the monthly CDC guidelines for physical activity. The total cost for the inactivity epidemic in our industry is estimated to be $147 billion. We see other industries taking prominent positions in the healthcare, integrating healthcare into non-healthcare companies. First, we have Costco giving members access to a platform called Sesame that provides them with $29 virtual medical visits or doctor visits and $79 in-person checkups. Amazon recently acquired a primary healthcare company called One Medical, which includes an online drugstore, Amazon Pharmacy, and doctor-patient communication. Walmart created Walmart Health in 2019, which set up centers inside their super centers that provide services such as primary care, dental care, behavioral health, and other services. Walmart expects to have 75 of these facilities open within the next year. And finally, CVS has also been working to expand its retail locations into a more robust healthcare company ever since it acquired Aetna in 2018. In this panel, we'll talk about the convergence of healthcare and health club. And what we start with a wider lens to understand what's going on in the broader industry with some of the companies we talked about. Then we're going to talk about some advocacy efforts within our industry. And then we're going to go into sort of the nuts and bolts on how to develop healthcare services and planning for the deployment of healthcare services within your facility. As Al mentioned, I'm Mike Levesque, CEO of My Zone of the Americas. And on our panel today, we have to my immediate right, pinch hitting today, and he didn't know he was going to be on the panel till this morning. I'm not sure on a panel of healthcare and health clubs if we're able to have a HIPAA violation and say his employee got COVID this morning, and so she wasn't able to make it. So pinch hitting today for Cassandra is Chris Crater, CEO of ACAC and Weld Health. To his immediate right is Kevin McHugh, Chief Operating Officer of what was it? The Racket and Sport Club at the Atlantic Club in New Jersey. And to his immediate right is Dr. Carly Intelkoffer, co-founder of TRIO and global wellness researcher at Matrix. And then finally, we have at the far right, Craig Dixon, co-founder and CEO of St. James Group, a large fitness center. Well, I guess a fitness center doesn't probably do it justice here in Virginia. I'll ask each of the panelists to give a short introduction on their background in the industry. We'll start with Chris.
Hey, Chris Crater, CEO of ACAC as well as Weld Health. Been in the industry about 19 years. Also, chair of the URSA Board of Directors for the last year and a half. I actually had 1 year, and then I went to the bathroom, and they elected me for another year at the board meeting. Al said I'm nominating him. Anyway, it's great to be here, and I really appreciate using the old headshot. That's a pre-COVID headshot when I didn't have any gray hair. But Al asked for the headshot, and I said, get the one from the URSA. It makes me look younger, the URSA website. So I'm really happy to be here and excited to be on part of the panel.
My name is Kevin McHugh. I'm the president of the Atlantic Club in Manasquan in Red Bank, New Jersey. I'm on the board of the Medical Fitness Association, as well as on the National Health and Fitness Alliance here with URSA. I've been in the industry for 31 years. Started out as in sales and marketing, and then been for the last 12 years the COO, and recently, about 2 years ago, the president. So we were excited about mental health also and alliances for our industry, and we feel that we're just at the cusp of really taking the hospital and the insurance and also the medical fitness as an opportunity for all of us to get involved and just be more than just what we're doing, a traditional health and fitness industry.
So at Matrix, one of the fun things I get to do, which I know isn't fun to everyone, but I like to read the research and find out those really key studies that can help move our industry forward. one of my problems with academia, which I spent a long time in, is that it's kind of siloed. You don't really get to speak to the general public or industry leaders about some of the key findings that your lab may discover. And the truth is, virtually all of the best research in the world is funded by the US taxpayer. We're talking over 90% of the research that makes it into top tier research journals. And I know the top tier research journal, again, doesn't mean much to everyone else, but these are really powerful findings that can help support our industry and support healthier lives for years to come. So it's my pleasure to bring some of that as part of my role at Matrix and Trio, and to really get the word out about the incredible power that moving your body has for not just your body, but obviously your brain. And along with that, I serve as a board member for MH1, which is a UK-based group that's focusing on mental health and also trying to help people make peace with their relationship with exercise.
Good morning, Craig Dixon, co-founder and co-CEO of the St. James. Unfortunately, I can't tell you I've been in this industry for 15 years or 30 years. I'm probably one of the relative newcomers in this space. I was a lawyer before I got into this business, but really got into what we like to call the kind of sports and wellness business because of the hugely positive impact that my participation in sports had on my life, both as a kid and continuing on as an adult. And I'm a parent of 3 children who have experienced the same benefits, and really seeing an opportunity to go into the space with a real coaching focus and a vertically integrated approach to create differentiated experiences for people that will last their entire lives. And so this panel is really important because what we see, one of the chief obstacles that we have facing us as we think about the opportunity to converge fitness and healthcare is the point that the doctor just brought up, which is where the financial incentives lie, and without being able to start to direct some of the financial incentives or open up things in a way that will allow more participation from folks in this industry and people in this room, it's going to be an uphill battle for us. And so that's one of the things we have to be very focused on as an industry, in my view.
Okay, thank you, panelists. I'm going to ask questions to designated panelists to start with, and then each question will be opened up for hopefully a lively discussion on these topics. First, we'll start out with Craig. Craig, in recent press, we've heard about other industries diversifying their offering to include healthcare or wellness. Examples that I mentioned already include Costco with partnering with Sesame, Amazon purchasing One Medical, Walmart launching Walmart Health. How do you believe that providing healthcare and wellness services supports their various business models, and what can we learn from them?
Sure. So, Mark Andreessen, who is a Silicon Valley venture capitalist, founder of Netscape, and kind of really prominent figure in the tech business, once said, "Software is eating the world." Well, chronic disease is eating the future. And when you think about that in really stark financial terms, it's pretty scary. We've got half of the prospective candidates for military service can't pass the fitness test and are therefore ineligible for service. So the kind of national security of our country is at risk. Significant numbers of active service members are also suffering from chronic conditions and really couldn't pass their fitness tests. Absenteeism is like a $800 billion problem in this country. And then you've got presenteeism, which is less spoken about, which is people actually showing up for work, but still too sick to be able to be effective. And so all these large companies they're looking at the data and they're going where the dollars are. And so I think the thing that these guys are focused on is the fact that people are having to spend increasingly large numbers of dollars in order to try to manage their healthcare, and then importantly, the U.S. government and the insurance industry are also funding the spending in this area, and so they're therefore moving into these spaces, but Unfortunately, they're downstream from the thousand decisions and behaviors that a lot of these people could be engaging in if they had the appropriate support that would prevent them from even getting to the place in a lot of cases. There's a lot of debate right now in whether the U.S. government should fund the GLP-1 agonists like Ozempic and Mounjaro for people who have a wide range of kind of weight challenges and not just people with diabetes. But, if they took some of that money and actually invested it in ways to help people spend on wellness in a really broad and flexible way, not specifically healthcare, but to try to think about it in a much broader way, including, being able to support gym memberships or an active lifestyle, they wouldn't have to spend as much money on the coverage of those very important drugs that help change a lot of people's lives.
Yeah, fantastic. Anyone else? Good. Okay, second question. And now that we have Chris on the panel as well, we have another expert on this. I have a multi-part question. IHRSA is taking an active leadership role in advancing legislative initiatives, including the FIT Act. First, we'll start out with what is the FIT Act? How can you explain that to the group? Where does it sit legislatively in the process? Why is it important to the industry? And how can fitness professionals get involved? So let's start out with what is the FIT Act?
The FIT Act is an old act that has a new life. I've been around FIT for probably 11 years or so. I've never been more positive about what it can provide us in the near future. But to me, FIT means something different. It means the health and fitness industry can really start being a part in the wellness industry too, because the FIT Act is, as if you don't know, is basically changing the language of what the current HSAs can do. So HSAs can do a lot of great things for high deductible plans. It used to be a very political issue because HSAs were known to be only for the rich people. But what happened is, since Obamacare and other high deductible plans and insurance companies, the amount of people that can now have an HSA is over 100 million people. When you take a look at that percentage of our entire population, it may not be perfect, but it's very strong. But what it does is it allows clubs, all of our clubs in this room, it gives us the opportunity to really get involved with preventative care. And you say, well, how can I get involved with preventive care? I really don't do preventive care at my place. Do you run an arthritis program? Do you run a cancer program? Do you run a diabetes program? And if you don't and you want to, there's easy way. Nothing's easy, but there's ways to get involved the right way. What the FIT bill would do for us, forget insurance companies, forget everything else. It would allow people and individuals that need our help, because we're the best places to get the health, whether it's mental health, whether it's physical health, to be that the pass-off program. So, for example, at Hackensack Meridian, which we do a lot of work with, when that patient is done with their program and insurance stops covering everything, they need us because they're not ready, they're not done. And so what happens is there's no place for it to go because they have to pay for it. If we had the FIT bill and they were able to use that for their diabetes, chronic disease, rehab from cardiac occasions, or even orthopedic industry, we are the only source, we are the best source, and we can be reimbursed for that. So the FIT Act actually provides our clubs the opportunity to serve more people. That's why it's important. Yes, it's important because, yes, we can get gym club memberships out of it because you can get up to $1,000 a year on gyms, but you can be getting a membership and you can also be doing something for chronic disease in all of our locations. The other thing that FIT bill does is it addresses youth sports and childhood wellness. And I think that's really key for all of us in this room to know, because kids that are active at an early age are active at a later age. And if we don't stop the obesity issue, if we don't stop inactivity, if we don't get them out of their homes, this is going to be a problem that's going to be far beyond what we can solve. So the FIT Act has a lot of tangents. I don't think years ago we looked at it that way, but it really is a comprehensive bill that can change our business. And wouldn't it be great to have all of us have the opportunity to have an individual come in with $1,000 a year, to join your club. And we also know if they have that, more people will join when something's free or less expensive than when something is expensive. It doesn't matter if you're a hospital-based club, it doesn't matter if you're YMCA, it doesn't matter if you're a studio, a multi-purpose club, it works for everybody. So what FIT is now much more universal, a lot of support, and has a lot of tangents, Mike.
Kevin, can you just briefly detail, you glossed over HSA as if everyone knows about it in this room, but what is an HSA, how does it work, and why would it be so accessible to 100 million people in the US?
Sure. An HSA is a health savings account. So when you have a high deductible insurance plan, the government allows you to get an HSA, which will help cover the deductible that's required when you have a high deductible insurance plan. So what happens is that HSA has a language and it says what you can use it for. It can be used for, you go into an emergency room and they don't cover half the cost of that. A lot of it's medical based, but then there are things in that language that are eyeglasses. And someone said that every December they wind up buying 2 new pairs of eyeglasses just so that they can use up their HSA money. Wouldn't it be great if they could buy a mitt or something else for their child during that period of time? But it's a health savings account. There's also a flexible savings account that the employers give. When you combine those two together, there's 100 million people that qualify for that. And once again, a lot of those are your members. Probably most of your members will wind up getting, that are under the age of 65, will have the option to have an HSA, which will give them the opportunity to save $1,000 at your health club.
Fantastic. Thank you. Chris, where does it sit in the legislative process at the moment?
Yeah, good question. Right now, FIT is working its way through Congress. Every time there's a new Congress, there has to be reintroduced. So for those of you who've been around for a while, 2018, it actually FIT passed the House, which is a really great thing. But then Congress changed hands that fall, and before the Senate could take it up, you have a new Congress, you start all over again. So it is really difficult. You're on these 2-year cycles of getting things introduced and hopefully passed. Next year is a election season. So before the presidential election takes all the oxygen out of the room, we're trying to gather as many sponsors for the FIT Act as we can, and hopefully attaching it to a larger piece of legislation. Just to be clear, FIT isn't going to get an up and down vote on the floor. We're not going to have a bunch of congressional folks going yay or nay for FIT. It'll be attached into some big bill with 2,000 pages, and hopefully we can get that sucker in there. The key is to get local support from your own congressional leadership. So if anybody doesn't know how to do this, I certainly recommend reaching out to Mike Gazinski, Jeff Soulsby I see in the room, also from MRSA, and asking how you can help. Because the more sponsors we have on the legislation, the easier it is for the powers that be in the Senate and House leadership to attach that bill to the larger initiative that's going to get pushed through.
Great. And any other ways fitness professionals specifically can get involved, either talking to their local representatives or joining the industry association?
Yeah, obviously this is a plug for IRSA, but I think that having an association to represent all of us as fitness owners and operators is vitally important when things like FIT come up. Certainly it's helpful to kill legislation that's harmful, right? We certainly do that. But also if we're banded together and we're a unified voice, it makes it much harder for people to say no to us on Capitol Hill. There's a health club in every county in the US, I think, and certainly in every congressional district. So we're a well-represented industry. I think we just don't do enough to, I think, promote our own voice. There are 60 million members, right? We're talking about close to 20% of the US population. And we have a lot more power than we think, but we only can exercise it if we all get involved and unify, and certainly hope that you all, A, become IRSA members, but B, find a way to support either nationally or in your local community.
Okay, great. Thanks, Chris and Kevin. So Carly, over to you. For years, the industry has promoted the preventative health and mental wellness aspects of physical activity. Why was the fitness industry, in your opinion, largely ignored as a contributing factor to lowering the mortality rates during the pandemic? And what can we do differently going forward to be viewed as part of the solution if it ever happens again?
Yeah, I think we were all frustrated by that experience, to put it mildly. And I was naive. I actually thought, oh, now's our chance, because as someone who's close to the research, who's participated in the research, and who's been reviewing it for so long, I thought, of course, they're going to see that it's the folks who have the best cardiorespiratory fitness, who have the best survivability. So gyms will remain open. I was wrong. There were a few exceptions there, but what we were really seeing was a reaction to the very small amount of research that had been done on the virus, and all we knew is that it was transmitted person to person. And so the primary imperative for health policymakers, for many doctors, was just to enforce this idea of social distancing, of staying apart. And because gyms are a place that brings people together, it's one of the best parts of the gym, that made it really difficult for lawmakers to consider that gyms were a critical essential service. So it was kind of a frustrating experience for all of us, and it was because of a lack of understanding of the risks associated with widespread lockdowns. I will mention, though, I think there were a few exceptions, a few business leaders who were able to network as part of their state fitness alliance and were able to remain open. But I know that that was extremely rare. And overall, of course, it was really damaging to the industry. I think moving forward, some of the terms we've already discussed up here are important to keep in mind. We need to have a unified front. And we also need to amplify the voices of physicians, particularly infectious disease docs, who do support that the gyms need to remain open. I strongly doubt in my lifetime that we'll see another lockdown, knock on wood, but the truth is, we can't afford it. We can't afford it from a morale standpoint. If you think about the people that we lost during COVID to COVID, it may in fact come out 10 years from now that the mental health toll was so significant, I'm hoping, that there was no possibility of a lockdown. So what I think is going to happen is that now we have hundreds of studies on the negative effects of the lockdowns. We have hundreds of studies showcasing the mental health decrement in our nation and others. And we have hundreds and hundreds of studies that are all saying that the individuals who kept their exercise habits going, that kept their social connections strong, they fared the best. So I think we need to look at exercise not as something we do for muscles and strength, but as something that we do to support healthier, happier lives, something that we do to support relationships, and something that we do to create community, because that's what all of you do in your facilities. So I think that moving forward, I've certainly learned a lot from the experience. I was naive to think it could never happen, but I'm actually more hopeful today than ever, especially with Ursa helping with the advocacy front, with more, again, physicians, doctors, other people outside of our industry supporting that, yes, we are an essential service and we're critical to keep open, somewhat regardless of what happens in the future.
Yeah,
Can I connect what Carly said,
Sure,
actually
of
back
course.
to something that Chris said earlier, and Chris didn't pay me to say this, but I'm going to say it. We experienced firsthand in Virginia the power that getting together as a group and as an industry can have, and having direct conversations with the lawmakers and the regulators to talk them through how and why the decisions that they were making kind of on the fly with imperfect information was not only negatively impacting our industry, but the fact that they were closing our industry down was having a negative impact on people. And so it really is important for us as an industry to connect the dots around the data and the science, right? Because if you're able to put forth credible studies that demonstrate that the cardiovascular health that people have been building up because they have an active lifestyle helps them withstand disease, and then the mental impact as well of shutting down activity, especially with kids, is something that we have to be very cautious about doing, and then we can get that information in the hands of each other and band together both at the federal and state level. It'll help position us much better in to navigate the whatever else comes. I mean, just think about all the money that the pharmaceutical industry has and the associations that they have to advocate their positions. we're not able to be, we're not going to be able to match them dollar for dollar, but we can organize ourselves in our large numbers to coordinate and to push forward an agenda that will help us as an industry because we need to.
Can I just say
Great,
one
thank
other
you.
thing? I think there's a framing issue with our industry. And what I mean by that is, you know, we're not looked at as healthcare. And ultimately, that's why they're going to go ahead and shut us down because we're seen as this thing that is a luxury good, so to speak, or a thing that, is a nice to have or the whatever. But reality is if things like fit pass, we're now part of healthcare, right? The idea is that when the communities know that we're healthcare and not just health club, we're not just a gym, I think that language then gets reinforced in the communities. Right now, if you asked a lot of people in your clubs, they probably wouldn't think of us as healthcare. So it's up to us to continue to reframe our industry in that vein. And again, going back to the Fit Act, like if you think of health clubs as a reimbursable service as part of a health savings account, that actually starts people thinking about, well, wait a minute, this is actually healthcare. This is actually something that I can spend my health savings account on rather than, oh, great, it's this thing that's nice to have. There's a new one opening up in my neighborhood. Let's go over there. I think it will change the feeling of legislators as well, because now they're going to be looking at it as, well, wait a minute, this isn't just the health club that I used to know. This isn't the old industry from the 80s. And quite frankly, a lot of our older congressional leaders are probably still stuck in that mindset. And it's up to us to change it.
All right, well said. Chris, back to you. The global healthcare industry is valued at $12 trillion, of which the U.S. represents an estimated $800 billion. In comparison, the global fitness industry is $30 billion compared to $12 trillion of the healthcare. Without going into deployment strategies, which we'll touch upon later, what are the general monetization strategies for health clubs to reap the benefit of the larger healthcare pie?
I appreciate the easy question. Thank you. We actually, there's a lot of ways to attack this, right? I mean, ultimately, if you're looking at healthcare, for all of you who are aware of healthcare billing, it's very complicated. If any of you have worked in medical practices or anybody has worked in what I would call a physician's office, physical therapy, you name it, how you bill and the codes you use are pretty complex. And I would say that on the software side of our business, we help a lot of clubs, YMCAs, actually do medical billing for services inside of health clubs. So it is possible to do it. There are a number of services. Many of you probably run these. Dietitian services have been out for a while. And people run those successfully. There are also programs like the Diabetes Prevention Program, which can be billed through traditional Medicare insurance nationally. So there are ways to monetize programs and certain services inside of clubs, and those have been done successfully. The challenge is that it can be complex, right? It can be tough to train the people for a number of years, to get people credentialed, to get the contracts established. Like this isn't a flip of a switch. Just as a kind of a sidebar, to get credentialed and contracted for a new dietitian, say in your health club, could take 6 months to a year, depending on how good you are at paperwork. I've actually personally credentialed a club in Medicare diabetes prevention. The amount of paperwork, if you've never done it, is pretty intense, right? Getting everything submitted, having it work, and going back and forth. So, if Cassandra was up here today, and I would say that she truly is the expert in this space. So if you ever want to reach out to her, please do. She actually does webinars on behalf of the CDC to teach people how to bill for diabetes prevention, and they pay her to do it. So I think she's really the expert. But I would say that for all of you looking to get into this world, understand that medical billing is going to be tough. Exciting though, there are codes that are coming up that could be billed for that would have an impact for health clubs, specifically around health coaching. Many of you have seen a rise of health coaching in your clubs. Certainly nationally, health coaching is on the rise. There are tens of thousands of health coaching professionals. And right now there are CPT codes, which essentially are the codes used to handle medical billing, that are in a trial phase for health coaches. So if those actually kind of make it out of the trial phase to be universally adopted, you could potentially bill for health coaches inside of your club. So that's coming. And then finally, on the kind of direct, you can go out to any company in your community and run a program. Like, don't let this idea of this huge healthcare thing stop you from doing one little thing. Often, that journey of 1,000 miles in a single step, you can call a great corporate partner you have and say, hey, I'd love to run a weight loss program for your employee base. How can we help? what we've seen is a lot of direct reimbursement for services and programs inside of clubs from hospitals, from corporations and the like, where they actually will contract with their local fitness operators to provide a service, whether it be a weight loss or whether it be just a walking program, you name it, and actually have that service available. And we've run successfully medically supervised weight loss programs for school bus drivers, as an example, who tend to be a very out of shape population. And so we've seen really good success with that. And then the final piece I would bring up is programs. I think there are a lot of programs out there that are very good, whether it be Parkinson's programs, whether it be fall prevention programs, whether it be, again, diabetes prevention, that you can run in your clubs pretty easily. Maybe not bill for insurance, but you can start those pretty quickly. And I know some of the folks up here, Kevin in particular, has run these successfully in his club. So I would certainly say that if you're going to go down the medical billing side, it's complicated, be patient. If you're going to look at how to do it really quickly, talk to your current fans in your community about how they can support programs you might run, and then do research about what you could potentially offer that already exists and get that new population into your club.
Great, thank you. Last question on defining the problem. We'll give it to Carly. Carly, a recent ABC Financial survey found that wellness was the #1 reason that members gave for joining a gym. What are the options for health clubs to meet the needs of the fitness consumer who visit our facilities looking for wellness solutions?
Well, I think we're all aware that folks are more interested in looking at the benefits for stress reduction, for mental health, for positive mood. I think it's a very good sign, but it also tells us that a lot of the newcomers who are going to the gym, they may not have clearly defined physical goals, and that's okay. I think the goal is that when they come into your facility, that they have a great experience first and foremost. Pardon me, because what it comes down to is repeated actions, right? It's not about showing up because you're stressed out once a month or it's really got to be a repeated event. And we know that the number one risk factor for attrition is the number of days since your last visit, right? So if we look at the studies, it's about encouraging frequency of visits. And if someone tells us they're interested in wellness, if they're interested in stress relief, that may mean that we need staff, that we need a number of professionals under our roof to be aware of how they can best support that experience. So I really challenge all the leadership here today to really think about how is my staff trained and how do they interact with the members, and what kind of conversations are they starting? What kind of goals are they helping them to nurture and grow in terms of physical health or mental health, et cetera? Not everyone wants a social experience at the gym. Some people have their headphones on. They do not want to be bothered. But I think that as we move forward, especially integrating technology, there will be new ways and there will be better ways to make the experience enriching and to help connect those individuals with other like-minded individuals, because that social accountability is still the top way to ensure facility adherence so that they keep coming back. So I think there's a social piece that needs to be worked in for those who are open to it. But I think it's absolutely a great sign, and it means that we can reach more of the population, not just the ones who want the glutes and the abs, but also the ones who just want to feel better, which is the bottom line of what we're providing.
Yeah, good. It seems like we've changed from a vanity industry to a wellness industry over the past 3 years, and it's probably a good thing. Okay, we've defined the problem, we've defined the opportunity, and now we're going to talk about deployment. If you want to make the decision to start to add these services into your facility, how do you do it? So there's 2 options to choose from when planning to include healthcare services. There's either partnership or developing internal programming. First, I'll go to Craig. Craig, partnering with medical services provider can be one strategy to enter the space. I have a multi-part question for you. What are the best practices when you're selecting a partner? How did you integrate their services into your offering? And what are some areas that you would caution others looking to do this to watch out for?
Well, let me start with the cautionary part first, and I think you will have heard others say this on the panel, is that it's going to take time to really build a lasting success in one of these partnerships, especially because a lot of the operators in the healthcare industry, that they're very large, they're somewhat bureaucratic, and they're also heavily regulated, and so they're very cautious about doing new things, right? So you have to go in with that mindset. At the St. James, we've partnered with MedStar Health, which is a large operator, both from a hospital and healthcare provider perspective, as well as an insurance perspective in this region. And it was born out of an active campaign courting every major kind of healthcare provider in the region as we were developing our flagship complex, because we had heard a lot of talk about healthcare providers wanting to meet the consumer where they are instead of having to rely on people coming to them in a hospital setting, which a lot of people are scared to do, frankly. And so we started to just engage them and talk to them from the perspective of what they are trying to achieve, right? Every partnership requires that both parties get something out of it that they would like, and so really talking to and engaging with people in the industry and trying to understand what goals they want to achieve is the starting point of any kind of successful partnership. And then I'm a big believer in kind of minimum viable product and then expanding from there. And so figuring out something that you can reliably execute on, that may be starting off small, but once you start off small and you get momentum, then that creates enthusiasm for people to do other things, both within the context of your partners, as well as from what the consumers see you doing, and then they start to say, well, why don't you guys do X, Y, or Z? And so, our partnership with MedStar includes them having a physical location within our flagship complex. We've got 450,000 square feet, so we could give them 5. And they do primary care, sports medicine, rehab, and then they also help us on the content side with respect to things like concussion prevention and maintenance or avoiding sports injuries, and then some of the more relevant topics to just the general consumer who may not think of themselves as an athlete, like diabetes prevention and cardiac risk, etc. But this has been a multi-year process, right? And so it kind of started by us just getting them co-located with us so that they could get in front of our consumer, and then starting to expand on the content side from there.
Thank you. Chris, you have some experience with partners that are available in the industry, maybe just not the sort of weld advertisement, but what's available to gyms that don't have this specialty in-house, and where can they access the specialty?
Yeah, so I think one thing and jumping on what Craig said, is you got to find that one little thread to pull, right? Like if you call a giant medical center, let's, call up the road Johns Hopkins, and you called Johns Hopkins and said, hey, I'd like to partner with you. Well, that's kind of tough, right? Like they're a big entity. How do you grab a hold of them? What I would say is, I think one little takeaway from this is talk to the marketing department, because what we have is eyeballs and traffic. Look at what our leverage is as a health club. What's in it for them, going back to the partnership concept, is our people coming through our door every single day. I mean, our club has millions of visits at ACAC. And I would say when those folks come in, that's potentially a hospital consumer. So working with our marketing department is often an easier way to get a hold of the hospital than trying the more direct send me your patients route, right? And so what I would say in terms of developing partnerships is you have to have a little bit of a patient attitude, but also you have to pick the right hospital. What I mean by that is not all medical providers are created equal. MedStar is a very entrepreneurial group, as Craig mentioned, but there are others that are less entrepreneurial. So you're going to have to find that hospital in your region that has an entrepreneurial spirit, and quite frankly, you're going to need to find yourself a champion inside of that bigger hospital system who believes in what we do in fitness and wellness. Because there's a study that came out, maybe it was 2013 or something along those lines, in Oregon State, and it famously talked about how little exercise education physicians get in medical school. I think it's like 80+% of docs have no exercise education and graduate. So if we're going to go through that route, we have to understand that not everybody in their field understands what we do, and you're going to have to find that 1 out of 5 who can be that true champion to bring them in.
Great, thank you. Dr. Carley, can you provide examples of successful partnerships between health clubs and healthcare providers? And what is the metric for success? Is it profit, symptom management, or customer retention satisfaction, or all of the above?
Yeah, I think that's a tough question because it's the all of the above is really true, right? If you talk to the hospital consumer, which is an interesting way to look at that member, they are trying to avoid using their health services. And that's what we know is happening from the research standpoint. We know that the individuals who have the higher frequencies of exercise, those few who reach those physical activity guidelines, very few, right? They have the best health outcomes. They cost the less. They see their doctors for complex issues the least. They have just such an advantage, and that's something that could be available to more people. So I really look at that in terms of, it's like a raising tide raises all boats. It's like, what does exercise not help us with? And I look for it. I look for it in the research, and there's only a few specific genetic conditions related to mitochondrial dysfunction, and they're rare, for whom those exercise guidelines do not reduce symptom severity. And we're talking like a tiny percentage of the population. I've never even met someone with these conditions, and I've been looking for them. These mitochondrial conditions that are sometimes worsened by cardiovascular exercise. So, who is it not helping? And so that's part of the excitement that I have for the future is that as research continues to pour in, I could not find all this research in the 90s. Yes, we knew about the heart disease reductions, but it really has only been in the last like 25 years or so that there's been enough high quality studies to where this is we're on the right side of history. So to skirt around the question, there are so many things that exercise helps, and it's just a matter of selecting what advantage you want to promote to help your members stay more engaged, because your influence is really more local when it comes to reaching those members, of course.
All right, fantastic. On the other side of partnership is developing your own internal programs. And this next question is going to go to Kevin. Developing your own programs with an external medical or external professional membership association like Medical Fitness Association is another way to integrate healthcare into a fitness facility. What services did the MFA provide you, and what ongoing benefit do you receive from them?
Yeah, the Medical Fitness Association was one of those associations that was mentioned in Pat's award. Was there was a lot of friction between for-profit and not-for-profit. And when we joined the Medical Fitness Association, I think Chris was already part of it. We were one of maybe 4 clubs that belonged to it. They have different strengths than the commercial clubs have. Commercial clubs are very good at running businesses. Medical fitness clubs are really good at getting outcomes. So there's a different, when you talk in a medical fitness conversation, they're talking about their patient outcomes. They're not talking, they don't use the word membership. When we talk in commercial, they talk about membership, and they don't talk necessarily about outcomes. When you can merge the two together, I think you really have a strong foundation to go on. And we can, what's going on in Medical Fitness Association. We have that meeting next week, and I'm on the board of Medical Fitness. So I love IRSA and I love the Medical Fitness Association. You can live in both worlds. They shouldn't be separate. To be honest with you, we're all one industry. We all learned that during COVID. What it has done for us, though, is when we got our medical fitness certification of the 44 acres in our Red Bank location, it opened a door for us to have a medical advisory council, because we were now, it wasn't a commercial thing, it was a medical fitness program. So our doctors, we have 13 doctors on our medical advisory board. We meet quarterly. They are the ones that help us with our programming and support with referrals. Before COVID, we were averaging 202 doctors a year referring into our programs. That was because we had a badge of medical fitness. We had the badge also that we were a medical fitness certified facility. The other thing that it does do is when we went to the hospital, Hackensack Meridian Hospital, 13 hospitals in the state of New Jersey, and we wore the flag. They knew we were a great commercial club, but they didn't know anything about the fact that we were a medical fitness certified facility. we are the only club that Hackensack Meridian has ever put their name next to, and we run our mental health programs with Hackensack Meridian. We have monthly lecture series with Hackensack Meridian that are virtual that go throughout the state, and it says the Atlantic Club Hackensack Meridian Seminar Series. It doesn't cost us a dime and doesn't cost them, but what they do is they provide all the doctors. What we also have with Hackensack Meridian is they have all their screenings done at our location. So the angio screening, if you wanted to buy a Bruce Springsteen ticket in New Jersey, it would not be as hot as getting an angio screening at the Atlantic Club.
Wow.
There's only a certain amount of spots, but I'm telling you the truth, and our marketing, Christina's here from our marketing department. You put that on, that we're having the angio screening, within 45 minutes, every single spot is taken. Okay, Bruce Springsteen ticket may take 50 minutes. But those are the things, but it's a different language that you start talking, but it's not, it doesn't, everybody can talk that language. You can go to your local hospital who probably offers these screenings and is looking to get, like Chris said earlier, patients. So Hackensack Meridian looks at the Atlantic Club and says, we have a lot of patients here that we can have. So, I think that's important. And then the other thing, Mike, is because of that, we got involved with Cooper. And so the Cooper Wellness Center and the Cooper Clinic. So our programs are not written by us anymore. So we used to write our own diabetes program. We used to write our own arthritis program. Our docs at our medical advisory council said, okay, I know they're ACSM certified, but I'm not that comfortable referring people to those programs. I just don't. I know you do a great job, Delanco, but so when we, through COVID, and I really feel bad for all of you guys that weren't closed for 8 months like we were, because during those 8 months, we could look at every single aspect of our business and from every single thing. So if you were closed for like 1 month, I really feel bad for you. But Cooper came out of that because we looked at Johns Hopkins, we looked at Mayo, we looked at Cooper, and Cooper was the one that we wanted. So our programs are written by Cooper, and what we do is we're trained by Cooper, and we execute the same exact programs in New Jersey as they do in Dallas, Texas. And once again, it's not a big investment, and our staff loves it. And it raises the bar a little bit for us. And I welcome all of you. I know I've been in the industry 31 years, but I feel like I've been in the industry for like 2, because every 2 years we seem to change our business. And so I cringe when someone says 31 years. I remember when I first joined this industry, seeing people that were 30 and said, I never want to be like them, because they're talking about the past, and we can't talk about the past anymore. We got to be living in the present and the future. And I think you have power that you don't realize. You can go to a medical network and they'll listen to you, but they're not going to listen to you if you're talking about memberships. They're going to only listen to you if you have a program. And they're not going to listen to you if you have a program unless it's an arthritis program. Because a GP doesn't say, well, we want to send you to a program. They say, well, what does your program do? Oh, it takes care of cancer, it takes care of arthritis, it takes care of diabetes. No. What's your diabetes program? What's your arthritis program? And once again, you can get these programs. And I try to just say, it doesn't have to be Cooper. There's stuff you can buy. You can work with Mayo. You can work with, other associations. But I'm just saying there's a lot of talent out there that you can tap into. And I think it just creates that differentiator for you.
Yeah, that's great. I have one more question, and then I'll open it up to questions from the audience. We have till 45. Is that right? Yep. So a question for the panel. We'll start with Craig. For years, health clubs have marketed to corporate clientele to increase their membership revenue. What healthcare services are corporations seeking for their employees that health clubs can provide, and how do you attract this unique segment of the market?
Sure. So what we have found to be successful has been a coaching program that we put together that is a combination of our digital app. We've got a digital coaching program in our app, as well as, in some cases, access to our physical locations where if the employee wants to, they can come work out and do the workouts. Our app has a combination of physical training, recovery, as well as meditation and kind of mental wellness kinds of experiences. And coming out of COVID, you had a lot of employers become very experimental around how they can try to, retain employees, attract employees, get people to come back to the office at some interval, and also thinking about their healthcare costs and some of these issues of absenteeism and presenteeism. So, and I still think that a lot of that sentiment continues to exist, but it is more challenging when an employer is contemplating some kind of subsidy or paying directly in a way that is not further subsidized or covered by their healthcare providers, and so you have to. We've tried it by launching beta programs or pilot programs where it's a small number of people, and then we have to prove ourselves. And if the people, the employees feel like it's impactful to them, then we get more people and you get more companies. And so it's kind of a group sales kind of experience, group sales campaign in the way that some of us are experienced doing with memberships, but instead of offering just memberships, we're offering a program or other things.
Any other experience with corporates on the panel?
No, the only thing I would say is that any corporation that has Blue Cross Blue Shield in New Jersey, for example, they have Blue Bucks. And they get that, there's an allocation of Blue Cross dollars for wellness for that company. And if you have those companies, we have one that's Jersey Mike's, which is around the corner from us, that we're working on. And they have the top of the line Blue Cross Blue Shield. And we know that they pay for nutritional counseling, and then they have Blue Bucks to pay for different programs. So some of the insurance companies do have employer compensation plans to advance wellness for their employees. So in New Jersey, it's Blue Cross. They're the best ones at it. But in your state, there may be someone else. And you don't have to be, you're not billing back Blue Cross. It's all coming from them to support the employer to actually re-up with them the following year.
Great. I've got a few more questions, but I'd like to open it up to questions from the audience. Any questions?
Well, I'll just speak loud. My question is for Kevin. I'm just trying to get a sense of what the investment is for going through a medical fitness association certification. So
the medical fitness certification is very much like an ISO 9000. If you've ever heard of an ISO 9000, they take a look at the total quality of your organization. They take a look at all your employees built into the mission, and so they go through 212 points of excellence in your facility. But the cost is, I would say, it cost us about $8,000 the first year that we did it. And probably could have been up to 12, but we had to run training programs, we had to run safety programs, but it was probably one of the best $12,000 we did. And and everybody is involved with it, because when the inspectors come to your site, they don't ask Kevin McHugh a question, they ask the housekeeping person a question, they ask the landscaper a question, and they want to find out, is that person really tied into the mission of your company, or is it just the leadership that's tied into the mission of the company? So it really is a great team building exercise. We do it every 4 years, and I would just say, take a look at it. It's our facility. We decided to do 44 acres. You don't have to do that. You could just do your fitness facility. But like I said, Al, it could be $8,000 to $10,000.
Okay, fantastic. Other questions? This question, right?
Chris, do you have how many locations?
To the club side,
Yeah.
we have 13 clubs.
13. All right. Kevin, you guys have 2, right? And then it's Craig. Craig, you have one large one.
Three.
Oh, 3. Okay.
But one larger than the other 2. Yes.
I guess it's a question for everybody. What would you recommend for folks out here who have 10, 20, 30, 40 high volume, low price operations where you can't dedicate the same amount of time, attention, and resources to the programs that you guys have put in place?
Yeah, I'll comment on that first. Obviously, a lot of you are running programs, activity or health activity, related to insurance paying for memberships for individuals to access clubs. So I would say that that's growing as a percentage of population. So for those who aren't currently doing third-party paid memberships, I think you can expect that more and more commercial payers are going to be entering the market of this. And that I don't see it slowing down. So that's obviously one. And I will say that Medicare, which has started with the Silver Sneakers program, which everyone kind of knows is like a brand name in the industry, that it's now, because it's extending to commercial, it tends to pay a little bit better in the commercial side, broadly speaking, only because I think, there's more flexibility in a commercial pay than, say, with the federal government and Medicare, which is probably not a surprise. The other thing I would say is, we are seeing crazy models out there, right? And with Weld and the company we run, we see a lot of cool stuff happening. So we have a YMCA group, and by the way, if you guys don't pay attention to what Ys are doing, I would recommend it. I think there are a couple of Ys around here, or maybe in this event. But we have a Y group that gets 450 referrals a month from physicians, but not for medical stuff. They're doing it for weight loss programs. So what I would say is, even if you have clubs that are not necessarily as high staffed as what we would operate, up here, I do think that, you have a trainer who could run a weight loss program. Most of us have personal trainers of some type. You have somebody who could basically create a referred to program, because look, on the doctor side and the medical side, every doctor, at least with 44% of the population, during the physical, if they show up, is having that conversation. Hey doc, yeah, you should work out more. What should I do? And at that moment, your club can be an answer if you have a program they can refer to. Doctors are not going to want to invent their own program. They don't even know what to do, right? So what I would say is, having that program available is really important. The last thing I'll point out is, you can do a little bit of marketing to the physicians. We are not a pharmaceutical product, right? So you can actually market to doctors in your community that you have these programs. You look at your member database. How many people have the prefix of doctor in your member database? Start with them. They're already members. Try to get them to refer, right? I mean, it doesn't have to be super complicated. And like a weight loss program is something that I think a lot of us have tried and run in the past. And that might be a good place to start.
Just a follow-up question to that. Seems like the HVLP segment really looks to create efficient relationship between the member and the club. How can you digitize that relationship in the healthcare space? What ideas do you have? Maybe we'll start with Carly.
Yeah, I think one of the points that we haven't touched on too much is the importance, honestly, of wearables, because they can help document improved outcomes. Not everyone cares about their heart rate variability, but for those who are curious or who want to get involved or who want to start, more cardio, for example, wearables are a great option to try to keep them engaged so that they can actually see some demonstrable improvements, which is crucial. So much of what integrating our industry with the medical industry relies on is those documented outcomes. So if we have individuals pay more attention to their heart rate data, we know that they're much more likely to tune into information about heart disease and stroke. And I know that these aren't fancy or sexy things to market about, but there are a lot of people out there who've had an incident, or their mom or their dad or someone they love has had an incident. So it is on people's minds. And I think that by making it kind of a frictionless experience to have a connected solution in the club, through equipment, through wearables, through the integrations, we can get more people going. I have to say, it has to be frictionless. And that also, harkens back to the first thing I was mentioning about challenging your staff to really understand how to pair and how to connect the many devices, the equipment that you may have. Because if your staff doesn't all know how to do it, or if it's difficult, you better believe that your end user is going to be frustrated with the experience. I know I've had that experience many years ago where there was no one at the front desk who could help me figure out my data. This was like 8 years ago, so I was using very rudimentary items, but that makes my device almost worthless to me, or it makes it lose value. So I think it's important that it's actually the fitness industry professionals who understand how to pair a wide range of devices, at least the most popular ones out there, to make sure that when members come in and give it a shot for the first time, they're not discouraged, because it's not fun strapping on a heart rate monitor for everyone. So that alone takes some courage and some different approach, and you'll quickly get rid of that device if it's not working to your expectations.
I would like to challenge one point that I think wearables are fancy and sexy also. But we have a wearable panel coming up tomorrow, and we'll discuss that further. Next question.
Question for the panel, slightly self-serving question, but getting back to the subject on employee wellness, corporate wellness, second largest cost to an employer after salary is medical insurance. So we know that employers are very keen to get their employees fit and healthy. Yet McKinsey comes out with surveys and says that today, despite the fact that 74% of employees, when they're offered fitness memberships, use them extensively, only 15% of employers actually offer fitness memberships. Now, remember, we're an inclusive world, and we're also in a hybrid world. So how do clubs today manage to attract corporates who, A, have to have inclusivity? You can't offer just the Atlantic Club. You've got to offer a choice, and you've got to offer a choice not just across clubs, but across the whole spectrum, including wearables. So question for you, how do you, as a club owner, attract corporate members and actual members?
Well, I can only tell you that one of the projects that we are working on is in New Jersey. Hackensack Meridian wanted, they're working with the Atlantic Club, but they said, what about our place in Hackensack? What about our place in South Jersey? And we really have to work as one in the state of New Jersey because they can't offer one product to one place. Employers can't either. So like Jersey Mike's, they have locations throughout the state of New Jersey, not franchise locations, but employees. I need to have someplace in Cherry Hill. I have to have someplace throughout the state, or else they won't offer it. So if I'm Shoes, Corey, for example, you may have a location that covers an employer's all their employees may be covered in the state of Arizona at one of your locations. That would be a real positive for you to put into. So if Jersey Mike's had 100 employees and they have Blue Cross Blue Shield, but it doesn't even matter. But if they want to do a program, you could say all your employees can go to a Choose Fitness because I have a location within 10 or 15 minutes of where they are. That's the problem that we have as an industry. We don't have one company that can go the whole state for the insurance company, for the hospital. But that's a challenge because they'll say, I had visiting nurses and they had 3 states, I couldn't help them. I could help them in New Jersey, to where I am, but the VNA wanted to do a major program with us in 3 states, and Mike Benton's in the back there. We couldn't make it happen because we didn't have enough critical mass of other clubs like us that would be able to deliver that. And that's a problem for our industry. We should be able to do that. I should be able to call you up and say, guess what? I got Jersey Mike's. They've got 6 employees in your area. This is the program that we want to run. Are you on? That's we don't have that yet. So in the person that follows me at the Atlantic Club, that will be one of their challenges, in the next 15 years, to figure that out. But going back to Corey's point quickly, Corey, yes, mental health is something that you can get involved with immediately, and your ads can be in mental health. It could be stop feeling stronger but feeling better, and you can be that arm in your advertising for people wondering of their solution because we know exercise and mental health are so strong. So I'll leave it at that. I'm sorry if I didn't answer your question fully, but that's the struggle that we have.
Well, if we can fix it for you. I'm from Seattle, but thank you.
Okay.
Hey, we got Chris, the president of IRSA here. He'll fix everything. Just put it on your list.
I will. As soon as I put my heart rate monitor on, I'll do that.
Yes, which is really easy. One more question.
Hello? Okay. So I was just at a lifestyle medical conference last week, and a lot of these same topics were brought up. And so a couple interesting headwinds, I think, but an opportunity, and I'll pose it as a question. So one is that physicians now, the time that they have with the patients are eroding, right? So the opportunity for prep-like programs where we can put the onus on them to drive folks to us is becoming harder and harder, right? So I think we need to figure out how to play a bigger role. But my question is, another thing that I found interesting, presentation after presentation, lifestyle MDs were showing the efficacy of exercise beating pharmaceutical intervention, but then they would show the data and show that the real problem was attrition from those programs. And so ultimately they wouldn't beat pharmaceutical intervention. And ultimately the end of their presentation be like, so the best we have right now is pharmaceutical intervention. So how as an industry can we play our part and show that we can actually get folks to stick to these programs? And where are kind of the choke points? I think historically what we're seeing is, and you guys have touched on it kind of piecemeal, that we don't have the skill set yet to kind of develop those programming. I've heard programming over and over again. And so getting that right is going to be an important piece, but then also showing the data so that we can be like, we do now have the efficacy of these programs so that because we're retaining people, we can finally start to beat pharmaceutical intervention.
Yeah. So, hi, Mike. That's a good question, a good point. I think the way that I would look at that is these programs have a beginning and a middle and an end. This isn't something that goes on forever. So ultimately, what we found is having those members integrated not just into a specific program, but really in the community of your club makes a difference. We've on the data side, we have hundreds of thousands of data points over a long period of time for programs run inside of health clubs, as well as YMCAs and the like. And what we found is people who adhere to the program, generally speaking, become longer term members. And this is how I would approach this. If you can, and we know this, right? If you sell a membership and you can have that member be very active in the first 60, 90 days, the chances of them becoming a long term member are higher, right? We've seen the data on this. In a medical program or any kind of intervention, if you can have that individual come more often in the first 60, 90 days and complete the required assessments and meetings, they will stay longer, period. So we looked at our own program, which was the prep program for ACAC was a 60-day program. If we had 3 assessments built in, and the difference between the number of people who became members and who finished all 3 assessments and the percent that actually would do 1 assessment and join was absolutely staggering. So again, it's not just about getting them in, it's actually making sure they complete it, especially early, to build that adherence. We have the data too, Mike, on the DPP programs and the others are from around the country that I'm happy to share with you, but it's pretty compelling that that's really the trick. So.
All right, very good. I think we're going to have to end it there. I think we all realize that the convergence of healthcare and health club is going to become more rather than less important in our future. And so I wanted to thank the panelists for their insights today, and I think they will all be around. I'm sure we have other questions. I think they'll all be around for the next 2 days if you have any questions for them individually. So thank you for your time.
Thank you, Mike. Well done.